Hey guys, my name is Dunn. I'm a licensed physical therapist in Austin, Texas, and I've been doing this for over 2 decades. And I wanted to go on today and share a little bit about why I use Pilates machines and equipment and exercises and gyrotonic machines and equipment and exercises with my physical therapy patients every day. So why do I use these modalities? Well, first of all, Pilates came into my world many years ago, back in 2002, when I was looking for a job when I lived out in California. Someone asked me, "Hey, do you have any Pilates experience?" I'm like, no, I'm not familiar with that word. Well, I got hung up on, and that conversation ended quickly. Well, lo and behold, a few weeks later, I was like, the heck is Pilates? And I saw a Pilates studio in the place where I was living in LA. And I ended up going in and getting some information about it. And then I ended up seeing a ad in the LA Times for a PT with Pilates experience. So the first guy hung up on me when I didn't know anything about it. This next place ended up hiring me with no experience at all because I was willing to learn. I ended up joining a Pilates teacher training program at the time to get certified in Pilates. And boom, that was it. From 2002 in January till about September, October, I was deep in training. And then I started using it with every single one of my patients that walked in the door. Now, why do I use Pilates? Let's go back to the question. Well, Pilates is a whole body exercise routine. It combines mental connection with physical connection. So it's a mind-body exercise. So it's not just aimlessly exercising without any intention or focus. So it's very much about paying attention to your posture, your breathing, and moving in a controlled environment. So with that said, if someone has a shoulder pain and they come in to see me, well, I'm not just strengthening their shoulder for 40 minutes. I'm actually strengthening their whole body, because if we strengthen the shoulder for 40 minutes, a lot of times it's too much. It ends up aggravating and irritating it. And a lot of times the shoulder problem is actually a compensation for some other things going on. So we start addressing the whole trunk, the whole body, the core, the shoulder stability, the shoulder blade stability. All of a sudden it's a game changer. So I've had people with shoulder problems that with strengthening their core made all the difference. I had people with knee problems that strengthening their core made all the problems. I've had people that with hip problems that if we get their head in the right position, it helps their hip. So again, holism is the main reason that I've used it, but I've also continued to use it since 2002 because of the results that I get and the results that my patients get. That's really what I should say. The improvements, the gains, the goals that are met. And gyrotonic's the same. It's a modality. Most people don't know what the heck gyrotonic is, but it's a three-dimensional movement system, works the spine and flexion, extension, rotation, and side bending. A lot of sitting exercises. So it's great for our modern culture who sit all day. So I use both Pilates and gyrotonic for the holism of it, for the mental connection, for the postural re-education, and you're stretching and strengthening together. You're not just strengthening, you're not just stretching. It's the combination of the two. So that's it in a nutshell of why I love Pilates and gyrotonic for my physical therapy patients. So every patient that comes in the door, they're getting introduced to these systems, learning to breathe, learning to move deep in their core, learning to move with intention and purpose. So that's what I got for you guys today. I hope that helps. You understand why I teach Pilates and gyrotonic in my physical therapy session. Y'all be good.